Hi, everyone. Good to have you back. I'm Dr. Funke Afolabi Brown. I'm so excited to be here. I have a treat for you. You have no idea. I have a real sleep expert here, all right? You know that everyone I bring here usually has some expertise in one area of life that relates to sleep or that's directly related to sleep itself. But today I have an incredible friend and colleague here, and I've been looking forward to for you to meet her. And her name is Dr. Melisa Moore. She is a friend, a colleague, like I said before, and we're going to be talking about all things kids sleep. As you remember, I am a physician. I'm a sleep medicine physician. So my expertise really focuses on, of course, medical things that are related to sleep. I do address behavioral stuff as well. But then you'll come to learn that when we talk about sleep issues, we're talking about so many dimensions, especially when it comes to kids' health. So, Dr. Moore, I am just so thrilled to have you. Can you
Yeah,
introduce yourself to our friends and what you do?
sure. I hope I can live up to that. That was such a nice introduction. So, I am Melissa Moore. I am a sleep psychologist. And you might wonder what that is. I'm sure most people do because there aren't a lot of us, especially in the world of pediatrics. So, what I do is I help people with their sleep habits, with evaluating their sleep, with sleep problems, really with anything having to do with their sleep. And as you know, if I'm concerned that there's a medical problem, then I will reach out to a physician like you, um, and have the patient be evaluated that way. But in general, I see people with all kinds of sleep problems.
Yeah, and we're going to dig into all of that very soon. And I think this is the beauty about the work we do, right? Because it's such a collaborative approach to taking care of a child's sleep. And the work you do is so unique, especially like you mentioned, people like you are rare find, right? So tell us just a little bit, like how do you're a psychologist, but then how does the sleep piece come in? Do you do additional training? How what does that look like?
That's a good question. So for me, I was already in a clinical psychology PhD program when I became interested in sleep. So as a graduate student, I was really interested in teenagers and I really wanted to have a big impact. So I started looking at what were the leading causes of morbidity and mortality in teenagers. And at that point, it's a little bit different now, but at that point, it was car accidents, suicide, and homicide. And one risk factor that related to all three of those was sleep. And
Mm.
so I started looking into sleep quite a bit and got really, really lucky because there were some amazing people where I trained who are fantastic sleep mentors and experts at what they do. So I was very, very lucky. So after I did my coursework for my PhD, I did an internship at the Children's Hospital of Philadelphia and was able to work with other sleep experts, Jody Mindell and Lisa Meltzer, who are both behavioral sleep medicine experts. And after that, I did a postdoctoral fellowship for 2 years, specifically in behavioral sleep medicine. And during that time, I also worked at the Children's Hospital of Philadelphia. So after that, I took my sleep boards. So, behavioral sleep medicine boards. We have to take a special exam in addition to the exam, the boards we take for clinical psychology in general. So after all that, it took about 8 years. Then I worked at the Children's Hospital of Philadelphia for many years, more than 15 years, and just have recently gone out on my own.
So thank you for taking us through that. And the reason why I wanted to highlight that is, there's a lot of stuff out there. There are a lot of people out there that claim to be sleep experts or
Right.
consultants, and everybody has that right intention, right, to help sleep.
Yes. Yes.
Hold
Yes.
on, hold on. So thank you so much for taking us through or behind the scenes, because like I said, there's so many sleep experts, right? Everybody that's read a book on sleep is a sleep expert, so to say. But I just wanted our friends to get a sense of what this really means to be a sleep expert. You've been in training and you had additional training and you needed to be board certified to be able to be that expert to take care of kids with sleep issues. So it's incredible. And I just wanted to put a shout out. That's how we met. We've been working together for almost
A long
what,
time,
like 7 years. It's
long
so
time.
y'all, we have history, but we're gonna try to keep it official here. Okay, we'll try to keep it official. And Dr. Meltzer and Dr. Mindell, incredible giants in the
Mhm.
field and doing such amazing things, really pioneering this field of sleep medicine in children. And so, what other question I wanted to ask you is, you had already alluded to that you do see all kinds of sleep problems in children. So, what are those problems? What kind of issues do you see when it comes to sleep in children?
So I see anything related to sleep, but in children, there are disorders or sleep problems that are common to each age or each period of development. But in general, what I see are issues with trouble falling asleep, staying asleep, trouble waking up for school, difficulty sleeping independently. And everyone doesn't want their children or have the ability for their children to sleep separately. And they don't have to. That's not my job, is not to decide if they're co sleeping or not. My job is to help them if they want to change that. So, problems with bedtime, frequent night wakings, nightmares, nighttime fears. Sometimes nightmares are related to another trauma, and I will do treatment for that. But pretty much anything wrong with your sleep, I can either help you or I can send you to someone that can help you.
That's incredible. So you must be really busy. So how about teenagers? Because I feel like a lot of, even though, you do spend quite a fair amount of time with the younger kids, but you had mentioned, and of course, with working with you, I know that that's an area of expertise for you. And we actually co-authored a book chapter on sleeping teens as well. And you have so many publications along those lines. But what kind of troubles do you see with sleep when it comes to teenagers?
So I think that has changed a little bit since the
Mhm.
pandemic, actually. Traditionally, the issues that we see in teenagers are two things: a shifted schedule where either going to bed late and then having to get up at a set time for school. So they're getting insufficient sleep and then they're
Mhm.
difficult to wake in the morning, falling asleep in school, falling asleep after school. And then that just perpetuates more difficulty falling asleep. So that's one thing.
Mhm.
Another thing is difficulty falling asleep because you're just worried and thinking and can't shut your brain off. So we see those two things. And two things that have changed since I've been in the sleep field are there's also a little bump, I think, in obstructive sleep apnea
Mhm.
now. And that is really just due to the obesity epidemic. And since the pandemic, the major change is just with the mental health issues
Mhm.
aside from sleep.
Yeah, yeah, and
Very,
that's such a huge one. There's a crisis on right now, and these kids are suffering. So thank you for the work you do. And one of the things always talk about too is you don't have to wait until all the mood issues are resolved, all the depression, anxiety. We definitely want to partner with, the psychiatrists and other therapists that are taking care of the kids' mental health while addressing their sleep related problems.
absolutely. That's a really good point. I
Yeah.
think um, that I am a sleep psychologist, but it
Mm,
doesn't mean that I am also helping with depression, anxiety.
yeah.
I'm really focused on sleep. And so, even if your child or someone that you know is in therapy for another mental health issue, I'm happy to either consult with that therapist or to do really short-term just evaluation, consultation, suggestions within the context of that person having therapy. A
Mhm.
lot of times, many, many times, I am recommending mental health
Yeah,
treatment in
yeah,
addition to
yeah.
what I'm doing. And then the second thing is that studies show that anxiety and depression, when they are treated, the sleep problems that come with anxiety and depression don't necessarily go away. So
Mhm.
they might need their own treatment. So even if someone didn't have a sleep problem, they became really depressed, they developed a sleep problem, but then their depression resolved, they might still have those sleep issues. And
Mhm.
so I can really help offer targeted treatment to those things.
Yeah, yeah, and thank you so much for highlighting that. Another thing that I know, also with that because I know that because we've worked together for so long, is even when it comes to the medical sleep issues, right? You had mentioned obstructive sleep apnea. So say, for instance, you have a teenager who has sleep apnea and ends up, maybe not necessarily getting surgery, or maybe they do get surgery to get their tonsils out, and now they still have what we call residual sleep apnea because we repeated a sleep study and they're still having snoring and difficulties breathing. And we need to prescribe CPAP, right? You
Yes.
definitely help them with that because
Yeah.
CPAP is effective, but it's not pleasant for most
It
teenagers.
to or get used to. And I think for most
Yeah,
parents, providers, you should try it. Try it
yeah,
on yourself and see what it's like because
yeah.
it's very important and it's a crucial part of staying healthy.
Mhm.
However, it can be a challenge to get used to it.
Yeah, yeah, yeah. And so I know you've helped me with a lot of my patients who may need what we call desensitization and things like that to get them wearing it through the night. So this is the kind of partnership that's really just so remarkable for me. And I just think it's so enriching. Then I also wanted to highlight that even children with narcolepsy,
Mhm.
we do have teenagers, that's around when they get diagnosed. Sometimes we also want to include some sleep habits. And I know you've definitely helped with that as well.
Yeah, I think we tend to think of narcolepsy
Yeah,
as a disorder that's fixed by medicine.
yeah,
And part of it is, but it also comes with a host of other things,
yeah,
transition in life and in school, people needing accommodations. When things like driving come up, how are we going to negotiate that within the family? And then really just things that help the narcolepsy, the sleepiness in itself.
yeah.
So taking a planned nap every day, not
Mhm,
necessarily just waiting till you fall asleep in school,
mhm.
but using that as part of your day can really
Yep,
help.
yep, yep, yep. So we've kind of we went from like, babies who don't want to sleep alone to teens. I want us to just go right back and just maybe finish up with a classic example, say, for instance, of a child that shows up in your practice and how you typically would approach. Of course, we won't be able to go into nitty gritty because this is not medical advice. Everybody needs to see their own, to see their own specialist to make sure they get the right treatment. But what does that look like if someone shows up and like, my child is not sleeping? It's awful. Nobody's sleeping at home, they're not sleeping, help. Like, what does that look? Walk us through an experience, say, with you as a sleep expert. What does that look like, taking them from point A to point B where they want to go?
So, in a baby, what I might see, what typically presents itself is a lot of night wakings.
Mm,
So, parents in general say, I'm okay with how the bedtime is working out, but they're waking up so many times during the night. Nobody in our house is getting any sleep. And so, what people often don't know, and why would they, is that we all wake up many, many times throughout the night. So, we all
mm,
go through our stages of sleep. We have light sleep, we have deep sleep, we have REM sleep or dreaming sleep, and then our brains wake up. And those wakings are happening to babies, to teenagers, to grown-ups, to everybody. So it's in general not that the child is waking up more than other children. It's generally that once their brain wakes up, they can't get themselves back to sleep. Now, the key and the light bulb moment for a lot of people is understanding that whatever you have to fall asleep in the first place. So, whatever environment you have, whether it's a parent being there, or falling asleep with a bottle, or falling asleep with the TV, or falling asleep on Snapchat. So, from babies to teenagers, it is true that whatever you to fall asleep and whatever you've been used to, you need that to get back to those normal night wakings. So I spend a lot of time helping families to develop more positive, what we call positive sleep associations. And those are things that don't involve necessarily other people or things that will prevent the child from learning to go back to sleep right away.
That's splendid. And again, this I've seen you at work, and you tailor it specifically to the patients and the family's needs. And I think I wanted to piggyback, because there's another question I get a lot with me working with moms who might have young children. And one of the things they're scared about and is like they're going to scar their child, they're going to scar their baby if they leave their baby to cry, or if they do any form of like sleep training or anything of that sort. So usually what do you, and I know you've done some research with this as well, so what's your perspective with that?
So Dr. Jody Mandel, who is a colleague of ours, and I did a study several years ago looking at behavioral sleep interventions for babies and toddlers for night wakings. And we looked at secondary variables to see was there going to be any impact on things like personality development, or maternal and child bonding, or attachment, or depression, behavior. We really looked at everything. And granted, these studies were not designed to find a problem, but reviewing the studies themselves, we did not find anything negative systematically that related to this type of intervention. A lot of people think when they hear sleep training that means they're going to put their child in bed, lock the door, and come back in the morning. And I have to say, I have never, ever recommended that. And I really do try to tailor the treatment to the family. So if the family likes sleeping all together and they don't mind these night wakings, again, it's not for me to say that they should. It's just for me to help with what they want. A lot of people also will ask for a detailed plan right at the beginning. And I don't typically do that because I don't know. I don't know yet. I want to see how the family's reacting, how the child's reacting, what's happening next, how people feel about things. And I feel like all that training that we talked about in the beginning really has grounded me in a place that I feel confident that I can really make those treatments fit that family. So I know that was a roundabout way of answering your question. But part of why I feel confident in my recommendations is because I have looked at those studies, and I'm confident that there aren't negative consequences to this approach. And I would never, ever do anything that would be harmful. So,
yeah.
No,
you were going to say, sorry.
Well, I was just thinking, one thing that I've noticed recently is a lot of people who have gone to sleep coaches and other kind of sleep schools will get a very detailed plan. And I think people like that, but it's not tailored to them. So, and I don't need to schedule every part of someone's day. So in general, I'm giving more general rules, not saying they have to eat at this time and 20 minutes later they have to take a nap or that kind of.
I love that. I love that really tailored approach. And I think that also makes it makes people feel seen and heard, right? Like it's not just a prescription that's just like automatic, but you're really reassessing and then you're saying, okay, let's make a collaborative plan moving forward to get your child and you the sleep you need. So this is really, really exciting. And so, we've talked about a lot. Today we've talked about who is a sleep psychologist and what role do they play and how do they get to hold that title and be that expert. We've talked about the different conditions that a sleep psychologist like you sees and the research around some of the work that you do. And we've kind of gone through the entire age spectrum. And so now you are leaving us at the edge of our seats. Any final words and where can we find you? Because we need you in our lives, right?
Well, I think first of all, sleep is really critical. I know that everybody has learned that from you. And as a mom, as a parent, you really have to be ready to want to do this stuff. I mean, I didn't do behavioral sleep training with my children when they were 3 months old. Some people do. There's nothing wrong with that. But for me, I wasn't ready. And I think just
Mm,
as a parent, a caregiver, you really have to um, stand up for what you want for your
mm,
child. So
mm,
that is my recommendation for everybody. Be the parent you want to be, and I can help you get there in terms of sleep. I can be reached on my website, which is drmelisamore.com. So it's DrMelisaMoore.com.
with
And I'm
one L, one
one
L,
S for everything.
one L, one S. Yeah. Oh, this has been so, so good. So you guys heard it. Prioritize sleep. Be the parent you want to be, and Dr. Melisa Moore will help you when it comes to sleep. And your favorite sleep doc is here. If you have any issues as a mom, whether it's your child not sleeping well, whether you're overwhelmed with what it even looks like to have restful sleep, and you're waking up with that constant fog, either because the kids have kept you up all night, or work has kept you up all night, or your racing mind has kept you up all night, you definitely know to schedule an appointment with me. Let's talk it through, and then I'll get you from where you are now to where you should be. And so it's been very nice hanging out with you. Thank you so much,
Wonderful.
Dr. Moore.
Thank you so much. And
Oh,
Dr. Brown is an amazing expert and sleep doctor, so don't hesitate to reach out to her either.
oh, thank you. I did not pay her to say that. All right, everyone. Until next time, I hope you rest well. Bye.